Assalamualaikum, my name is Aina Nabila binti Muhammad Noor. Today, me and my friends will present about Patau Syndrome. What is Patau Syndrome? Patau Syndrome is serious, rare genetic disorder caused by having an additional copy of chromosome 13 in some or all of body cell. It is also called trisomy 13. Each cell normally contains 23 pairs of chromosome, which carry the genes you inherit from your parents. But a baby with Patau syndrome has 3 copies of chromosome 13 instead of 2. It happens when cells divide abnormally during reproduction and create extra genetic material on chromosome 13. This severely disrupts normal development. In many cases, result in miscarriage or the baby dying shortly after birth. Most of cases of trisomy 13 are not inherited and result from random event during formation of egg and sperm of healthy parents. Baby with Patau syndrome grow slowly in the womb and have a low birth weight, along with other serious medical problems. Only 5 to 10% of baby born with trisomy 13 survive past their first year. Patau syndrome affects about 1 in every 10,000 live births. The risk is increase as the woman get older. The rate of occurrence is higher among children born to parents who are older than 35 years. It shows that more than 9 out of 10 children born with Patau syndrome die during the first year.
Hello everyone, my name is Faika. So today I'm going to explain to you about the symptoms of Patau syndrome. So first, the baby will face heart abnormalities. For example, congenital heart defects. So based on a research on March 2023, which is this year, 80% of infants with trisomy 13, which we call Patau syndrome babies, are affected with heart disease. Next, a child with Patau syndrome will face cognitive dysfunction, which includes memory, learning, decision making, and also language abilities, or to speak. So next, about physical symptoms. Patau syndrome babies have cleft lip or cleft palate, as you can see on the picture here. So it is on their palate bone. Also, they have growth abnormalities on their legs and arms, which is their long bone. So last but not least, Patau syndrome infants have gastrointestinal problem. This causes difficulties during eating. So that is all from me.
Alright, thank you my friend. So my name is Nur Atira Fateha. Now I want to present about diagnosis of Patau syndrome. First of all, for prenatal diagnosis, we have maternal blood screenings, which is a routine blood test for potential issues. Next is fetal ultrasound. It is a visual examination of the fetus for abnormalities. Furthermore, we can diagnose Patau syndrome by chorionic villus sampling, CVS, and amniocentesis. It is an invasive test for genetic samples. Last but not least, karyotype test is a common diagnostic test revealing chromosomal abnormalities. Alright, next one is postnatal diagnosis. First of all, you need to be aware of the symptom of your baby. If undetected during pregnancy, symptoms will become more apparent at birth. Next is genetic testing. It is to confirm Patau syndrome and distinguishes from other disorders. Okay, for the last one, we have 2 additional diagnostic measures. We have imaging studies, which is CT scan or MRI, to check for brain, heart, and kidney defects. Lastly, you can diagnose by echocardiogram. It is an ultrasound of the heart to assess cardiac abnormalities associated with Patau syndrome. That's all from me. Thank you.
Thank you. My name is Alia Shazvira binti Ahmad Safarizan. Now, let's move on to management of Patau syndrome. First of all, there are no treatment or cures for Patau syndrome. The treatment for babies and children with this disease is focused on the symptoms that they have. Let's take a look at the medical intervention. Firstly, surgical correction of specific abnormalities. This intervention aims to improve the affected organ function and enhance the individual's quality life. For example, cardiac surgery, cleft lip repair, feeding tube placement, and connective orthopedic surgery. Secondly, specialized dietary feeds. Many patients may have feeding difficulties due to oral and facial abnormalities. Therefore, feeding tube or specialized feeding technique is necessary to ensure adequate nutrition and hydration. Thirdly, speech therapy. As we know, speech therapy is needed in addressing communication challenges. Then, this therapy will help to improve communication abilities of patients. Next, behavioral and physical therapy, which focus on facilitating both motor skills and behavior. The fifth intervention is hearing aids. They are used to enhance auditory experiences and communication. Lastly, educational support, where it helps to optimize their learning potential and provide a supportive environment. The next part is treatment. The first treatment is post-delivery oxygenation and ventilation. This is required to support breathing and maintaining optimal oxygen level. And the other one is medicines to reduce symptoms. Additional treatment such as seizures prophylaxis and prophylactic antibiotics for urinary tract infection are employed to manage and alleviate specific symptoms associated with the disease. Thus, it can provide more comfortable and stable health conditions. In conclusion, it is important to note that the treatment approach for Patau syndrome should be individualized based on the specific needs and health status of each person. Regular communication and collaboration with a multidisciplinary team of healthcare professionals are essential to achieve comprehensive care and support for individuals with Patau syndrome.
Bismillahirrahmanirrahim. Assalamualaikum to lecturers. My name is Fazila Nabila binti Syarif Baharudin. So now I'm going to present about the causes and mechanism of the Patau syndrome. So as I provide here, there is 3 causes of the Patau syndrome, which is the first one is complete trisomy 13, and the second one is translocation, and the last one is mosaic trisomy 13. So let's jump into the first one first. The first one is complete trisomy 13. Complete trisomy 13 is a common causes of the Patau syndrome, which is we have the extra copies of chromosome 13 instead of 2. As for my research, this situation occurred due to the non-disjunction either in sperm or egg during fertilization. As a result, we might have extra copies of this chromosome 13. So next, the second one is translocation. As for this cases, Patau syndrome, translocation applied in these cases is Robertsonian translocation. So what is Robertsonian translocation? Robertsonian translocation occur when the long arm of chromosome fused together become a longer chromosome. This will occur changes in our genetic material. When it comes to changes in our genetic material, we call it as unbalanced translocation. So how this Robertsonian translocation leads to Patau syndrome? As from my research too, if a person who have this Robertsonian translocation on chromosome 13 married with the normal person, then during the fertilization, their offspring will be either less or they have more chromosome 13. So if the offspring have more chromosome on chromosome 13, then it will lead to Patau syndrome. But then if the offspring have less chromosome on chromosome 13, this also will lead to another genetic disorder, which is they have less chromosome on chromosome 13 instead of 2. The normal number is 2. So that's of Robertsonian translocation. Now let's move to the last causes, which is mosaic trisomy 13. Mosaic trisomy 13, the etiology is unknown because mosaic trisomy 13 is appearance of another copies of chromosome 13 on chromosome 13. So simplify, we have 3 chromosomes on chromosome 13 without any causes of that. So I think that's all for causes and mechanism. So thank you for your time.